Hi, my name is Shawn, and I am a patient of Dr. Schneider's from Rowe Plastic Surgery. I had lost 140 pounds, but the one thing that I had was a pannus, which went down to my knees, and it made walking and moving and getting in and out of a car, climbing a flight of steps. I could not even step up a curb because there was nothing to hold on to. So it made things really difficult in terms of all of those activities, and it really restricted my life. So I had gone to see one surgeon, and he told me to lose weight. And over the course of a year and a half, 2 years of seeing him, he continued to tell me that I needed to lose weight. I needed to lose more weight. I needed to lose more weight. And I finally realized that he didn't want to do my surgery. And I said, okay, I'm going to find a new surgeon. And I went online, and two plastic surgery practices both said, it's a cash business, so you would have to pay us cash. And I'm like, but this isn't cosmetic, this is medical. And so I just said, I'm done, I'm not gonna go there. I went back online and I said, I'm gonna start at the top of the list when I do the search. And Rowe Plastic Surgery was the first one that came up. And I called, and as soon as I spoke to the receptionist, the difference in how I was spoken to, how I was treated, I was told all of the things that I needed to do. I was given an appointment, and I hung up the phone and I was like, oh my gosh, somebody's listening.
So in terms of how we handle patients who might be reconstructive challenges, it really depends on a surgeon's training and also their experience, as well as their desire to do a certain case. So for me, anything that's an opportunity to help somebody, especially in such a dramatic way, that is something I'm going to try to make happen. I'm also very fortunate knowing that I trained at one of the best plastic surgery residency and fellowships in the country, and also having lots of experience with many different types of plastic surgery, many different difficult reconstructive cases. And so that gave me a really good foundation for feeling that, yes, I could counsel her about what she might expect, but also feeling that this was the right thing to do and something I felt comfortable doing. Now, in terms of how we at Rowe Plastic Surgery help get things like this covered by insurance, I feel so blessed to work with such an amazing team. So not only are my fellow doctors incredible, not only do I work with an amazing clinical staff, but we have a whole team of insurance specialists whose job it is to make this happen. And I will do everything I can, whether it's write letters, make phone calls. The insurance specialists will be working on this diligently from the moment that I communicate that to them. And that's one of the reasons why I think we as a practice are so successful, which I love, right? I love being able to make that happen for a patient in a way that's financially viable, because understandably, everybody's very concerned by how much something is going to cost. And particularly if you have a patient who's been essentially disabled for a long period of time, right? That's going to make it really hard for somebody to be able to manage to have that surgery to break down that wall, unless they're able to have a place like Rowe Plastic Surgery facilitate helping break down that wall and using the insurance company to help cover absolutely medically necessary reconstructive surgery.
When Dr. Schneider called me on the day of the consult, as soon as I saw her face, I knew she was my surgeon. I was so relieved at that point. As we did our little introductions to each other, she then said, we need to take care of this. You can't continue like this, and we're going to fix this. We then continued our phone call, and at the end of the call, I started to cry, and I said, I finally feel like I'm heard and that somebody's listening to me, because she was going to give me my life back.
I can still remember from my initial conversation with Shawn how surprised I was at how amazingly strong she was and how amazingly mentally tough and really pushing through a lot of challenges and really doing everything she possibly could to make things better. And I realized when I talked to her, I said, wait a second, this is a fixable problem. So it was abundantly clear from the first time I saw her photograph that she needed a panniculectomy, which is taking off a pannus. A pannus means the apron of skin that's hanging down that can happen with weight loss. One of the things that happened with Shawn is she had a dramatic 140-pound weight loss, but that actually worsened this area of skin because there was more falling down and the tissue itself starts to collect fluid, which really adds to the weight. I knew, especially after I examined her, that we would need to get some imaging and make sure that the surgery was safe to do. But after I was able to get that, I understood that the surgery was essentially a larger version of the panniculectomy, or in our practice for short, we call it a panny, that I'm able to do on a weekly basis.
I had my surgery 4 months ago. I had minimal to no pain, really no pain at all. I was up walking around the day after surgery. I went home the day after surgery.
One thing that was clearly very unique about Shawn's case is that her pannus, the tissue that was hanging down, weighed so much. So on a routine basis, I'll take out tissue weighing 5 pounds, 8 pounds, 10 pounds. For Shawn, she left the operating room nearly 50 pounds lighter than she came in.
I started physical therapy, and for the first time in about 18 years, I went on a plane ride, and I'm able to go shopping and play with my nieces. In July, we go do our summer vacation down the shore, and I will be on the beach for the first time in probably 14 years. I was able to walk 12,000 steps, which is the first time I've done that, and I couldn't tell you.
I think that my experience with Shawn honestly reminds me of what a great honor and privilege it is to be a reconstructive surgeon, because she came in at a point where she was nearly hopeless. You know, she had done so much work for so long and had really, again, reached this wall that she couldn't get past. And with careful planning, careful surgery, we were able to get her over that. And seeing what she was able to do, seeing where she is able to be now, seeing how she's able to play with her great nieces, see how she's able to go on a flight, it just lifts your spirit. One of the things that's, I feel very strongly that is true for me is something called right livelihood. So that means in what you do for work and what you do every day, is that something that is genuinely trying to help other people? And for me, Shawn really selfishly makes me feel great because it affirms my feeling that plastic surgery is the right livelihood for me.
Dr. Schneider has really, she saved my life. And I am so grateful for her because she listened to me and she told me exactly what was going to happen with the surgery. And anytime I called their office, everybody was pleasant and polite, and every person was focused on what I needed. And I can't thank all of them enough.
Shawn is a truly amazing human being. She came to me after so many months, so many years of work, and so many years of suffering. And by working together and by me performing the very specific panniculectomy surgery, we were able to get her beyond that wall. And she is taking a new step every day to move into a future for her that is more healthy, more active, and allowing her to live the life of her dreams.